All right, Chris, are you here?
Yes, Chris. Come on, get your exercise. Run down there.
Hi, I want to thank you for being here. And
Sure.
I'm a first-year student here at UNR, and I'm thinking about going through with the med program.
Okay.
But I want your opinion on where the salaries are going to be if this healthcare plan gets passed in my generation.
Right. You know, first of all, I applaud anybody who goes into medicine. And if you know physicians, some of the hardest working people you'll ever meet. They really are. They are just some of the hardest working people. We need especially more primary care, docs in the United States. We don't have enough doctors, by the way, if this bill passed, we don't have enough doctors in the United States to meet all of the needs that are going to be there. We don't. Where it's going to be in the future, the more government controls our health care, the more they're going to control, how much you make. You look at other countries, and that's what they do. They control how much doctors make, how much, not just doctors, but nurse practitioners and, basically everybody in the healthcare field. That's the way they control cost, is they ration care and they control how much people, make. And I just don't agree with that. I think that somebody, I don't blame, or I don't have any problem with somebody who's gone through umpteen years of school, works 100 hours a week for making a good living. I don't know about you. The way I want to hold them accountable is what I talked about earlier with transparency on cost and quality. Okay, I want them to have to publish their cost, but then if they can figure out a way to make money, let them figure out a way to make money. As a veterinarian, nobody limited how much money I could make. Okay? Veterinarians don't get rich owning a practice. I did very well. I mean, I was very, very made more than I make as a senator, but did very. But nobody limited. Who limited me were my clients who came in, whether they were willing to pay the bills or not. And I had to convince them. If I was more expensive than the person down the street, I had to convince them why I was better than the person down the street. Well, if we provide transparency on cost and quality, so we provide outcomes, then people actually, if you get 300 million people shopping in America for healthcare, you'll see quality go up and costs go down. It's the one place we really don't have shopping in America today is in healthcare, and that's just one of the major problems. Thanks. Good question.
Good question.
By the way, no matter what, I encourage you to go into it. It's a great profession. It really is. Great profession.
Thanks, Chris. Let's see, we have 5 more minutes left, and we're going to take 2 questions dealing with senior citizens. One from Sharon Black, who wants to know about your support, especially for the cost of senior citizens in Medicare in Nevada, and then Georgia, who wants to know about the Medicare Advantage plan. Okay, so let's start with Sharon Black.
Yeah. Are you Sharon? Oh.
She said that she feels like it's a repetitive question. It's already been answered.
Oh, on the Medicare Advantage one? The premiums, okay. So you know, like you've got a question answered.
Fine. Georgia?
Yes, good evening. I just want to say, Maurice, I appreciate you being here, and Senator John Ensign. Take the time out. I just noticed that the other senator from Nevada has been too afraid to have a town hall meeting. With that being said, I just wanted to make a note that Obama took my General Motors $5,000 bond and gave it to the United Auto Workers. Now Obama, Reid, and Pelosi want to steal my Medicare Advantage. Basically, I'm mad as hell. And I just came here tonight to see what we could do about defeating this bill. Thank you very much.
Okay. You like your Medicare Advantage? You like your Medicare Advantage?
I certainly do.
Yes. Of the people, just a show of hands, how many people again have Medicare Advantage? Just a show of hands. How many people of those don't like their Medicare Advantage? I don't see a single hand. So you all like it, obviously. That's been the satisfaction. Most people most seniors who like Medicare Advantage. Your Medicare Advantage, you'll still have it, but according to the CBO, the Congressional Budget Office, which is not Republican, Democrat, it's nonpartisan, they're the kind of objective scorekeeper. 64% of your extra benefits that you get will be cut by the year 2016. So you have very good reason to be concerned about this bill. Most Democrats, and I'm not trying to be partisan here, but most Democrats don't like Medicare Advantage. They just don't like it. They like traditional Medicare. They don't like Medicare Advantage. I think, are you Georgia?
This is Georgia.
Yeah.
This is
Go ahead.
I was wondering if I had it wrong.
We're okay. We're all good. We're all friends here.
I signed up again for my Medicare Advantage in late November, and I asked them specifically what's going to happen, and they said, you're fine for 2010. And I said, well, what happens after that? And she shrugged her shoulders and didn't say a word.
It's because it is unknown whether the bill's going to pass, for one thing, so she doesn't know. But if the bill passes, you can't take $120 billion out of a program like that, first, one of two things are going to happen with the Medicare cuts. The $500 billion of Medicare cuts, one of two things are going to happen. Just like your physician in the back, right? Every year, doctors are supposed to be cut, right? Under law. What do we do every year? We fix it, right? Okay? We're going to fix it. Doctors are supposed to be cut by 20%? 28% next year, or this year, coming up. Okay? That's going to be, as we had a 2-month fix, that's going to be fixed this year. We all know it's going to be fixed. Okay? By the way, the true cost of this bill is not reflected because that is about a 10-year fix on that is a $250 billion fix. So this bill actually does increase the deficit if you're honest about it. Medicare cuts that are in this bill are either really going to be cuts, and you're going to have cuts in services, or this bill adds a lot more to the deficit than people are talking about, because the cuts will never happen. My prediction is the cuts will probably never happen, because Congress, when faced with angry seniors, will go, ooh, okay, maybe we made a mistake. And then what happens, though? The deficit goes up. Then what happens to these young people? Their taxes go up. Okay? Your taxes go up. We're bankrupting America already. We're $12 trillion in debt. By the way, this bill has 2 brand new entitlements in it. 2. Something called the Class Act. Anybody heard of the Class Act? Okay? It's long-term care entitlement in this bill. It's a massive new entitlement in this bill, and in the out years, dramatically raises the deficit and the debt to the United States. And I'm telling you, folks, you better be concerned about that for our country's future. It's not just the kids, it's our whole country's future. And we better be concerned about this debt, this deficit. And it's one of the big problems that I see with this bill, because they used all kinds of smoke and mirrors to hide the true cost of this bill. The taxes go up the first 4 years, the spending doesn't start till after that. So, the true cost of this bill is much higher than what they actually say. It actually dramatically increases the deficit, even though they say it reduces the deficit by $80 billion. It doesn't do that, okay? And by the way, Republicans for years played tricks with the budget and this, that, and the other thing. I'm not defending it. By the way, I voted against most of that spending when Republicans were in charge. Republicans were, I kind of say it this way, Republicans were bad on spending, Democrats are terrible. It really is. And the bottom line is, we need to be concerned not as Republicans or Democrats, but as Americans. We need to be concerned about that. Right. And that's, one of the reasons we're doing these town hall meetings.
Well, with that said, we're out of time. We appreciate it. You want one more?
Yeah, let's take one. I can make it.
You can make it?
Let's take one more.
Okay, it's your time. All right, let's take, here's a good one. Marilyn Robinson wants to know about the impact on Nevada families.
Where's Marilyn? Marilyn's still here?